Welcome back to the Next Gen online video tutorial. In this video, we're going to go over how to find the HEADS assessment for an adult patient. Where you need to document the HEADS assessment is going to be under the Histories tab, specifically going to the social panel here. And before we get into it, I just want to point out that you're going to find home and environment, education, employment, activities, and diet by clicking the Add button, whereas you'll find drugs, sexuality, suicide, and depression, that part of the HEADS assessment within confidential history. So we'll go ahead and start off by clicking the Add button. And another thing I'd like you to note is the difference between these darker colored diamonds here versus these ones that are a bit lighter blue. So I want you to think of these lighter colored blues as like subsets of statuses and lifestyle. And when I say that, I really just mean that occupation and housing status is going to be within the statuses tab, while diet history and whether or not they have animals, so like environmental history, is going to be in the lifestyle tab. So you can pretty much ignore all of these subsets here, except for maybe the comments one, because that one you can just free text a bunch about your HEADS assessment if you'd like. And I'd just like you to worry about these darker colored blues here. So under tobacco, this is where we're going to do our tobacco screen. This is going to be a generic form of alcohol and caffeine, and we're not assuming abuse here. Once we enter statuses, this is where we're going to find the education and employment, some housing status information, what their support systems like, and you can feel free to comment within here. Under lifestyle, this is where we're going to find their activity level, hobbies, diet history, and you can get into their religious background as well as home environment and safety. And as I said, if we click into the blue tab here called occupation, this is really just a subset of what we could have filled out within statuses. Same thing for diet, history, environmental. Okay, so now we'll get out of here and I'll just enter into the confidential histories tab. And just as in our previous video, it's the same setup. We have our alcohol and drug abuse history here. We have our psychiatric tab where we can ask about SI and HI, along with our abuse incarceration history and their sexual practices and any STI information. And once again, you have a provider comment box here. And just keep in mind that all of this will stay confidential and will not print out on the Master IM unless you click this box here. All right, so in quick summary, to do a complete HEADS assessment for an adult, just come to the Histories tab, find the social panel, and either use the Add button or the Confidential History button, depending on what you need. All right, thank you very much for your time.